Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today, I want to talk about the importance of customer service. This day and age, with all the technology options and the lack of workforce or people that are willing to take certain jobs or people that don't need to work versus need to work or whatever the case may be, we are finding that customer service across the board, not just in healthcare, is declining rapidly. I can't tell you how many of my family and friends, just personally, I hear probably on a regular basis, they have tried to contact customer service over the phone for some reason. They complain because they never get to speak to somebody directly. It's always directed to an automation type thing, or they have to send an email or something that is very impersonal, as well as when they are in person somewhere, restaurants, shopping malls, stores, grocery stores, anywhere where you would expect to have customer service interaction, and it's just very poor. People are not very friendly. They're not good at eye contact. People aren't being held accountable. People don't want to face that they did something wrong. We have people who you can tell aren't happy with what they're doing, and so it affects everything. And it's just really unfortunate, but it definitely has been declining. And healthcare is not an exception, right? And I think this all started in healthcare when things started becoming very business in healthcare in America, when it was a business more than putting patients first and a service. And I also think that with the growing trends in the past of providers closing their private practices, going to more of the corporation type situations and big hospital groups and medical groups is where things really started slacking, right? Because people really liked that personal touch in those private practices. They felt very important with the staff who recognized them by their face and called them by their name, asked them about their personal lives. How was vacation? How are your kids doing? Are you feeling better? Things like that. When they call over the phone, oh yes, you can tell when people answer the phone if they recognize who you are or not. And the providers, the comfortability that they have. And since private practice has really had gone away for a while, it's starting to get a comeback again, but people are really missing that. And they don't like just being a number. They don't like just being in call queues to be answered and be done with. And it's very interesting to me, the statistics when I looked into this. I recently did a training for a client for their office staff, and it was very much focused on phone etiquette, answering phones, how to properly handle certain situations. But we also talked about in-person customer service, because customer service is not just for in person, it's not just over the phone, it's any type of communication, right? And a lot of people don't realize that nonverbal communication, which is the majority of the communication we have with people, to be honest with you, it's like 75, 80% of our communication with strangers, people we love, people we're close to, is nonverbal. And people are not aware that their nonverbal communication, their cues, can really influence how people perceive them and the interactions that they're having with them. So not only over the phone with the tone of your voice and the words that you choose to use, but also how you conduct yourself and hold yourself and your facial expressions in person. So I looked up some statistics before that training, and I wanted to share it with all my viewers because I feel like it's going to be very, very important. Coming from the clinical side myself, being a manager, I'm going to be honest with you, I never really focused a ton on customer service with my front office staff or my staff answering phones because I never had to. I was a very involved, hands-on, always listening and looking type manager. So I would address something right away if I saw an issue or I had a patient complain or have a bad experience, and we would work through it. But there are a lot of places where maybe you don't have the time to be that way, or you have a bunch of different locations, which I did as well, but you can't be there all at once, right? Or, there's different factors to it. So we get so caught up in all of the other things that are required with running a medical practice, claims and billing and patient safety and recruiting staff to work there. It's just really, really difficult. And sometimes this whole customer service gets taken for granted, and you assume that your staff is good at it and they know what to do. And I think that these statistics will open your eyes that maybe you shouldn't take that stance, and maybe it would be good to start observing a little bit closer, maybe doing some additional trainings with your staff, things like that. So one of the biggest points of interest that I found in the data is that 65% of patients will stop seeing a provider based off one single poor experience. And that doesn't mean a poor experience just with the provider. That's a poor experience with the practice as a whole. It could be the front desk, it could be medical assistant nurse, it could be your manager, it could be your biller, it could be anyone who they've interacted with or not interacted with and thought that they should have some kind of personal interaction that caused them to go elsewhere. This tells me a few things. One, it's very competitive out there because there's a lot of providers, usually in a lot of different areas and specialties geographically for patients to choose from. So they just figure, it's just a doctor, I'll find another one that can help me just the same, right? So if you haven't built that rapport with them, they're not feeling welcome, they don't feel important or individualized at your practice, they don't care. Bad experience, done. One bad experience. Someone could have a bad day. It didn't mean anything. It really was innocent in the person's eyes who caused the patient to have a bad experience, and you lose money because of that, right? So the other thing that it tells me is that it's really important to develop the rapport with your patients as much as possible, as fast as possible, so that they think twice before one bad experience sends them elsewhere. Okay? So that is really, really important. We always talk about word of mouth, and that's the most powerful form of marketing and advertisement, which is true, but bad situations, people talking bad about you can be just as detrimental as people talking good about you and recommending you can be beneficial, right? So we like to see it as the glass half full, which I appreciate. Everybody talks about how great my practice is, how good of a doctor I am, and I'm getting more patients. But have you ever thought about those bad experiences, that how much that spreads to different people, right? And if someone is willing to leave a practice or a doctor after one bad experience, then if they have something negative to say about you, how is that going to affect you in the community? So this statistic that I have written down, it says one patient will share poor customer service with at least 15 other people. So that one bad experience for that patient that decided not to come back will share their bad experience with at least 15 other people about the bad experience. And then there's a possibility that those 15 people will probably tell other people, right? You can do the math, and it's just not one of those things you really, really want to have happen. And this day and age, not only are they talking like verbally about the bad experience, they're probably putting it online. They're putting the reviews on Yelp, on your website, on Google, on all these different platforms, because unfortunately, I feel like not just in healthcare, people who have something to complain about are more likely to do it than people who want to give praise. So I try to be the person that if I have a really good experience somewhere, I try to make it a point to go put that positive review, because you're always going to see, it seems like, more negative reviews than positive reviews. And unfortunately, people don't keep that in mind when they're reading these and going, oh, but how many good things are there that people just don't take the time to do it, right? Because for whatever reason, us as a society, we'd rather share bad instead of good. And I really wish we would change our mindset about that, and we would be just as willing to share the good or more than the bad, because it's important to get a fair evaluation. And so people need to keep that in mind, but people don't. So that's just the reality. So 15 other people from one bad experience stop seeing you and possibly not be able to recruit new patients because of that. Okay. Big eye opener. And then the last little bit of statistic I want to give you is that 72% of patients said that having to repeat their problems to multiple people at the front desk specifically marked them to have a higher likelihood of a poor patient experience. Okay, so it's not saying, oh, I had to say it to the front desk and then I had to say it to my nurse or medical assistant so that the doctor could get the information. It was basically, I called the office, I told them what it was about. They said they took a message. I didn't hear anything back. I had to call back. I talked to somebody different or maybe the same person. They acted like they had no idea what I was talking about. There were no notes in my uh, chart, or maybe there were in this patient, or this person didn't look in the patient's chart to see if there was a note from their call before. And this patient feels very unimportant. They feel like whatever is causing them to call the office obviously is going to give them anxiety and frustration and anger already because of the nature of why they're calling the office. So then when they're having to repeat it and seem like that nobody knows what's going on, they lose confidence in that practice, and it makes them feel like they're having a very bad customer experience. That's why it's so important that whoever answers those calls knows how to triage them appropriately. Everybody knows where to look for notes if people say, I called previously, or even if they don't, they know where to go in the patient chart to see if they called previously. It's important that you have some kind of policy that you can communicate to patients that says, if you don't hear back by this time, we will definitely need you to call back, but you should hear something by this time. You know, we used to have a policy in family practice. If you called after 3 p.m., you probably wouldn't get a call back until the next business day. But if you called before 3 p.m., you would be given a call back by somebody. Okay, and having those expectations, setting those up for your patients will not only reduce people calling back over and over again, wondering when they're going to get a call back, but it also will make them feel good if you follow through on that and you make sure that policy is being followed. Okay, so not only does your front office need to know how to properly take messages, where to check messages when patients call, but also your back office needs to uphold whatever the front office is saying to the patient, and hopefully there's a global policy internally that everybody needs to be held accountable to, so that those patients feel that it's true and they don't overwhelm everybody with constant phone calls and they don't have poor customer service experiences. Okay, so I'm just doing a very high level on this, but I wanted to put those statistics out there because I felt like they were very eye-opening. It's very important. If you haven't looked at your staff as a whole and how they're providing customer service to your patients, I strongly recommend that you do that. And that if anybody needs retraining or they have further questions, once you ask them about certain things or you've observed certain things and you bring it to their attention, then I would do that as a whole so everybody can be on the same page. Okay. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this with all your colleagues whom you feel would benefit. I appreciate the support. We will see you next time. Bye-bye.